Hey guys, it's funny how this works. I literally just posted an article helping people understand how other patients made the decision that it was time to have their knee replaced. And I just saw this post in my Facebook group, Total Knee Replacement Support Group for Kind People. Let me read the post. Let me come back and we'll talk about this. So the member said, my doctor said I'm bone on bone. I need a knee replacement, but I'm not sure if I'm ready yet. How do you decide when it's time? I just turned 49. I have foot issues on the other side, but that is part of the reason I need it. The last 2 years, I've been mostly on a knee scooter or non-weight bearing on the other side, so my weight has been on this bad knee. And when they're saying that, it's because if you've ever seen a knee scooter, basically what's happening is you're kneeling on a pad, maybe an inch or two thick cushion, and you're kind of scooting yourself around. So certainly if you have an osteoarthritic knee, using a knee scooter can exacerbate the symptoms, can make it more painful. But that's a great question. Like, I've never had a knee replacement. I've worked with hundreds of patients who have. I've talked to thousands of patients who have, but I personally have never had a knee replacement. And of course, being a physical therapist, I get the good fortune of seeing everything that comes through my door. So today, as a perfect example, I had two patients who were getting their first outpatient physical therapy sessions done today. We were doing their evaluations. I was their therapist. And they were, like most patients, completely unique, completely different. There was one patient who had don't quote me, 110 degrees of knee flexion, but she was lacking like 12 degrees of knee extension. She was walking independently. She did 5 minutes on an elliptical trainer. She did 5 minutes on the bike. She was pretty much pain-free. She had a little bit of residue stuck on her knee from the dressing that had come off. But all in all, if you didn't know this person had a knee replacement, you never would have guessed that this person had a knee replacement. And this was her first time in physical therapy. She did have some home health therapy, and she did spend some time in a skilled nursing. So I don't want you to think that this was the first therapy ever. Another patient used to be super athletic, very active individual, younger adult, had a knee replacement today, was right around the 2-week mark, first outpatient physical therapy, I don't think she had home health therapy. But basically, she was a trooper. She came in on her walker. She was working to get 60, 70 degrees of flexion, but at her best, she had reached 90. She was struggling to build confidence in the leg, to know that the leg was going to support her. She had a very, very, very inhibited hip flexion quadricep deal. So in other words, if I asked her to lift her leg, she couldn't lift her leg. She couldn't lift her leg to get in and out of the car. She couldn't lift her leg to put it up on the bench. She had to manually use her hand, grab her ankle to pick up her leg. And so we worked on a couple, strategies. I've got videos on it where when the quadricep just is not firing, how you can get that quadricep muscle to start working. And she was super motivated, did everything that I asked her to do. She was actually going to the doctor for her first time follow-up right after our physical therapy session. Bless her. Because, I know what it's like the first time coming into a physical therapy clinic, even though I try my best not to overexert anybody, it just wipes you out, between the blood loss and shortness of breath and everything else you get from surgery. So I would say, when I'm talking to patients, through my experience, through what I've heard, through what I've seen, in most cases, there comes a time where there's a tipping point that the patient will say, I just can't take it anymore. Now, from clinical research, the clinical research and the recommendation used to be wait as long as you possibly can. We don't know how long the knee replacement's going to last. You don't want to get it in your 30s and 40s and 50s and then have to have a revision, have to have it changed. Now, the recommendation is moving to getting it done sooner. Because what we were seeing for a long time in the clinical research is that when somebody waited just too long, they become so weak, they became so deconditioned, they developed so many compensations that even once they had the new knee, it was really, really challenging to get them back to normal functional activity. Whereas if they got the knee replacement while they were still a little more fit, maybe still a little younger, maybe a little more active, the recovery process was just a lot easier. I don't know. Everybody is unique. I can never give anybody on YouTube medical advice, but I can say only you can make the decision. A lot of times it's when you've just lost the ability to do the basic things that you need to do on a day-to-day basis. So you can't go to work because a day of work leads to 2 or 3 days of miserable pain. You can't take care of your family or your kids or your husband or your wife because the knee is unstable and it's buckling and you're not sure when you take that next step if it's going to be there for you or not. When the pain has gotten to the point where it's just not relenting and it's changing your personality and you can feel yourself becoming an angry, bitter person that you don't want to be. Those are all signs that maybe it's time to have a knee replacement. And then for the individual who has already done all of the conservative care methods, the person who has already done physical therapy, the person who's already done the injections, they've already tried the pain management, they've already tried a multitude of different things and it's just not working for them. They need to know they gave it their best. Let's go get the procedure done. And I would say probably the most important thing that I see on a day-to-day basis is having the trust, having the faith, knowing that you've got a surgeon who's on your side. Because I've seen situations where patients might have a challenging outcome, but then they don't have a surgeon to support them or they don't have a physical therapist to support them. And that is really like just compounds the problem even more. I would tell any patient that, anyone in my family, any of my friends, every surgeon you go to is going to know how to do the procedure. It's not a skill deficit at this point. It's a personality deficit. You need to trust the surgeon. You need to know that if you're awake at 3 a.m. on the third day after surgery, which the third day typically tends to be the worst day of recovery, that there's a way to reach out to somebody, that there's a hotline, that there's a phone number that you can go through a telehealth session or through an e-visit or something so that you can get your questions answered. Or you need to have a physical therapist who can do that. I think most of the physical therapists in my network, people that I associate with on Facebook and professional organizations, as long as they can do it without violating privacy laws, most of them will have the ability to let their patient reach out to them pretty much 24 hours a day, 7 days a week. Certainly there are regulations and there are cases where you just can't do that. But I can tell you that every therapist that I know wants to have the ability to do that. This way, if their patient is in pain or uncomfortable or has a question and they really need somebody, they know that they can reach out to them and they can respond. So having the support, having the team around you makes the experience 10 times better. But only you can decide when it's really time to push that button, schedule that appointment, and make this a reality. I wish you the best. I'd love to hear your stories. If you want to post down in the comments below, what was it that triggered you to say, I'm done waiting, I need to get this surgery? Let me know. I'll catch you guys on the next video.